Hello, everybody. This is the second video lecture on the chapter of disorders. And the first video lecture, I was simply introducing the idea, the concept of disorders, and I introduced you to my nifty DSM, right? And Com was explaining how these disorders change over time. One thing I believe I failed to mention about the DSM is that in this book, it has all of the different symptoms, or it has all of the different disorders and the symptoms. And it also tells you, for instance, how long they have to be present. So an example would be that in order to get, say, an anxiety disorder diagnosis, you would have to have 6 of these 10 different symptoms, and they would have to persist for a period of 2 weeks, right? There's all of these different rules in order how to qualify for a diagnosis. In this video, I want to talk about anxiety, which anxiety is a group of disorders that are generally characterized by this pervasive sense of worry or dread. And I was trying to think about, if you've not experienced anxiety, how to explain it to somebody who hasn't. Your textbook uses language like tension, apprehension, these kinds of things, but I don't know that that makes a whole lot of sense if you've not experienced it. If you know what anxiety is, then it all, then this idea that you're just kind of anticipating something is going to happen, or maybe this sense of restlessness. It is, anxiety is thought to be the work of the sympathetic nervous system, that fight or flight. And it's considered a disorder because it's maladaptive. So here's a couple important words that'll show up again. Sometimes students ask me to explain what they mean. What it means to be maladaptive means that it's a kind of worry that doesn't serve any purpose, right? There are adaptive behaviors and maladaptive behaviors. Adaptive ones are ones that make sense. They prepare you. So worry can be very adaptive. It can prepare you for something bad that's going to happen. It can be logical. It can be rational. For instance, if you lived along the Gulf Coast right now, I'm recording this in late September during hurricane season. If you lived in the Gulf Coast where there were lots of hurricanes, to be worried about flooding might be an adaptive response. To be living in Kansas and be worried about a hurricane would be maladaptive. It doesn't make any sense. It's just using up energy for nothing, right? And in that sense, it's irrational when we spend our energies worrying about things that aren't going to happen. This can make it difficult for us to concentrate. So it interferes with our living. It interferes with our ability to concentrate on our job. Maybe we ask our partner or our family members or friends to do things for us that are unreasonable, right? And so in that sense, it's considered disordered or disorderly because it doesn't benefit us in any way, and it's not really reasonable. And that's one of the hallmarks of all of these disorders. Do they serve a purpose, or are they using up resources and energy that could be going to healing your cells or growing or investing in learning kind of things? Okay, that's why we call all these disorders. When this slide is a list of groups, different kinds of anxiety disorders. So anxiety is this generic term for worry that doesn't have a realistic or a utilitarian purpose. When we have this worry that kind of affects everything all the time, it's just this generalized sense of dread, we would call that generalized anxiety disorder, right? Because it's just this general state of being. I would consider myself to have generalized anxiety disorder. Just from time to time, I just experience these moments of just kind of low level, can't label it, just this anxious feeling. When it gets really bad and we experience symptoms that maybe we feel like we're going to die, or that it causes us to have like physical heart palpitation. It's common to have a heart palpitation with anxiety, but a panic attack is typically characterized by such a sudden and a profound sense of anxiety that we may think that we're having a heart attack. Sometimes patients go to the emergency room because they think they're having a heart attack. There may be no reason at all, or there might be a trigger for a panic attack, right? And so panic attacks are a kind of anxiety, but they come on very, very suddenly, and they're much more profound. They're much more severe. If this happens a lot, it's said to have a panic disorder. So for instance, it's not uncommon for somebody to have, say, a panic attack once a year, right? But when they happen a lot, right, and you can't anticipate them, that's what we would call a panic disorder. So you can have an anxiety attack, which is a sudden bout of anxiety. And usually one of the characteristics between a panic attack and an anxiety attack is the degree and a cause. Anxiety attacks are thought to be a lower degree or less severe, and to usually have trigger. Right? A bill came in the mail and now you're just all worried and you can't concentrate on your homework, as opposed to all of a sudden you feel like you're having a heart attack, right? I had a friend she suffers from panic disorder, and she describes how she would have to come home from work and just lay on the floor and she couldn't function. And she did this 3, 4, 5 nights a week because she just couldn't function. Agoraphobia, while it's called a phobia, a phobia is an irrational fear. This is a label given to someone who has fear of having panic attacks in public. So they stay inside all the time. They're afraid to go out. They eliminate all reason to leave their house because they have a profound fear that they're going to have a panic attack in public. So think about that for a second. It is a phobia of an anxiety disorder. Wow, really. And another thing about all of these disorders is they tend to run in families. So if, like, my mother suffers from anxiety, my daughter suffers from anxiety, I'm pretty sure I got some kin that have some agoraphobia conditions. That's actually one of the explanations. So what are the explanations for people who suffer from anxiety attacks? Well, we have this one called a triple vulnerability model, which basically says that people they inherit a genetic predisposition to worry and anxiety. They live a life where they have limited control over what happens to them. We talked about the role of control in a previous chapter. And they may be really, really sensitive to like their heart, like their physical changes in their body. Like, for instance, something that I'm aware of is when my heart flutters, right? When my heart skips a beat, but my mother doesn't notice when her heart skips a beat. So you might consider that to be hypersensitive, or you're really sensitive to like your digestion or your gastrointestinal, right? And all of these things mean that if there's some minor anxiety in the world and it triggers a physiological response, you may overinterpret that, or you may misinterpret it as something much worse than it is. What cognitive behavioral therapy says is, it says interprets physical signs. Okay, so it's a similar kind of thing, but what it means is when my body reacts in a way, I interpret that to be much worse than it really is. One thing that I have learned in dealing with my own anxiety is when I become aware of, say, my heart skipping a beat, or another one I get, and maybe you get it, is your eye twitches. Like it's this, and it's directly related to stress. And when I start to feel this eye twitch, I can say to myself, oh, I'm experiencing some stress or some anxiety. Now, I could focus on that eye twitch and say, I'm experiencing some anxiety, and that could make me more anxious, right? And I could make it worse. Or I can say, oh, I'm experiencing some anxiety. Maybe I should figure out how to reduce some of my anxiety, right? Another kind of anxiety, phooey, looks like I'm going to go over my 10 minutes here, are phobias. phobias are considered an anxiety because they are about irrational worry, right? All of these are about worry. What distinguishes a phobia, though, is that it's a specific trigger. So you can have phobias of a situation, of something in the natural environment, of blood, bugs, these kinds of things, right? Or you can have social phobia. And a social phobia, sometimes we call that social anxiety disorder. And it's in fact a kind of phobia associated or triggered by the fear of being judged by other people. Right. So you become anxious when you're in a social situation because you're just sure that someone is going to judge you. I always think about my son. He's on the autism spectrum. And one of the things that I remember, sorry, I'm trying to do two things. I was actually trying to see where this lecture is supposed to stop. Uh, One of the things I remember when he was growing up is because his anxiety would keep him from, like, if he was late for something, he didn't ever want to come in the room, but he would get so consumed, if you will, by drawing attention to himself that his anxiety attacks would actually cause him to draw attention to himself. So it didn't work out very well. This is at my 10 minutes, so I'm going to stop here. I want to come back. I want to talk a little bit more about the causes of phobias and particular kinds of phobias.